Moment. Masks are not a substitute for social distancing. Let me repeat, masks are not a substitute for social distancing. We need you to do social distancing everywhere you are. At work, if you're an essential employee and an essential business, at home with your family members, if you are out in the community and you're coming home to your family members, please use social distancing. It's really hard. I want to hug my kids. I want to be close to them physically right now, but I'm out in the community and I may be the person who brings it home to the family. So you need to remember that social distancing, even your own home, is important. You've heard the Centers for Disease Control, Dr. Adams, our Surgeon General, Dr. Acton, our Director of Health in Ohio, and our Governor talk about voluntary recommendations to cover your mouth with cloth when you're out in the community. I would like to echo that as a recommendation that, again, is not in place of social distancing, but will ensure that we can actually protect each other on yet another level. It's important that we think about the fact that we could be the person with the virus who doesn't have symptoms yet, and we're spreading it to other people. So we're doing our best to cover ourselves and to maintain the social distancing, two different ways to prevent transmission. But again, others around us may have it too. So it's a two-way protection, and we need you to do that. But I would ask that you please use cloth and not take surgical masks or N95s, because those need to be used in the highest risk areas. We have people working in intensive care units and emergency departments who are taking care of high volumes of people who are positive with COVID-19, and that's where our personal protective equipment, medical grade, needs to be. So I would ask that you please use cloth. That's what I used when I had to get groceries this weekend. I have cloth, covered my face. I'm not going to take a mask that I know my colleagues need in the front clinical care lines, okay? So I would say, if you could please consider, if you have surgical masks or you have N95 masks at home, in your garage, other places, please consider getting yourself a cloth covering, making one with a t-shirt and rubber bands like Dr. Adams showed on his video, or purchasing them from friends who are great at sewing, or whatever pathway you can find. Please consider taking those medical grade equipment, those N95s, those surgical masks, and donating them to your county emergency operations center so that they can be swiftly distributed to our healthcare providers who need them most. If you're in Cuyahoga County, you can reach the Cuyahoga County Emergency Operations Center for drop-offs between 9:30 a.m. and 2:30 p.m. Monday through Friday. And that location is at 2501 Harvard Avenue in Newburgh Heights. So I would just encourage you to please consider those donations. Even a donation of 1 or 2 masks is important, and we would gladly accept it and distribute it where it is needed most. I'd like to just finish with a few updates from Governor DeWine's press conference on Saturday. He signed an order which allowed increased access for telehealth services from counselors, social workers, and therapists.